Welcome to the Broken Minds podcast. So I know today is a little different. You can probably hear some noise in the background. Everybody's working, everybody's busy. It's just gonna be me today, and I know this podcast is coming out a little late, which I apologize. And scenery is different. The original podcast I filmed was trash. You couldn't see my face, it was just too dark in the room, and it just wasn't usable, and my audio was completely distorted, and it just didn't work. So, having to refilm this and edit it same day, short notice. But yeah. So today we're going to be talking about Heather Pressdee, a nurse serial killer. And if y'all remember, we covered Charles Cullen, who was also a male nurse serial killer who killed a bunch of patients and pretty much got away with it for like a few years, which is crazy. And then there's been a few nurse serial killers, which in retrospect is a very ironic thing, going into a field to help people and just doing the quite opposite. But yeah, there's one nurse named Lucy Ledby. She actually murdered a bunch of babies. Babies were just dying in NICU and no one knew why. And then it finally got connected to her, and she had about 7 confirmed baby deaths on her belt. Let's get right into the podcast.
Before we get started, we would like to give a big thank you shout out to our supporters:
Georgia Highlands College,
Rome Little Theater,
Chia Hall Harvest Fair,
Rome Shakespeare Festival,
WLAQ,
Rome News Tribune,
Megtread Collective,
Rome Emperors,
Rome Area Council for the Arts.
Heather Irene Pressdee is an American nurse convicted serial killer. She is serving life imprisonment, having been convicted of murdering 3 patients by lethal injection, and is connected to the deaths of 17 in total, which took place in western Pennsylvania. Pressdee was born on August 28, 1982. She was fairly a normal child. There's not much known about her personal life and growing up and when she was little, but there hasn't been many interviews with her. Considering she is the most recent female serial killer, there's not much really known about her. But we do know she went to nursing school and had the at least intention to help people at first, but something had changed dramatically. Pressdee had intentionally administered lethal doses of insulin to nursing patients throughout 5 nursing homes in Pennsylvania. The first 2 victims she was charged with murdering were 55-year-old James Bartow and 83-year-old Joseph Campbell, both of whom had died on December 4th and 25th of 2022. Her third victim was 43-year-old Nicholas Simbel, who died on May 1st, 2023. Pressdee was arrested in May 2023. She had been charged in relation to 3 murders and 19 attempted murders. She is connected to the deaths of 17 patients. In order to avoid the death penalty, Pressdee pleaded guilty on all counts. The murders in which she was admittedly pleaded guilty to were James Bartow, 55, Gerald Shrum, 90, and Nicholas Simbel, 43. On May 2nd, 2024, she was sentenced to 3 consecutive life terms of imprisonment, as well as 380 to 760 additional years. She is currently incarcerated at SCI Mercy. So of course we don't know much about Pressdee herself or why she necessarily did these things, but there are a few conspiracies that we can really include on things that we see like this. Like how Lucy Ledby, there's more about her personally, but she isn't one of our episodes. So if you don't know who she is, I encourage you to look her up. She has a very telling case, and even her interrogation footage is very concerning in itself. There is an interview with one of the moms of the babies that she personally killed, and she had visited the baby's grave, and she was just pleading so that she was so sorry and all of these things. But then why would she kill? She just felt like she had to, and it was more of a religious thing for her, which in a sense is wild. Heather, though, we haven't had much information on her, and there aren't many interviews really out there because she is more of a recent serial killer. She seemed like a normal person to everyone on the outside until she started being connected to these murders. Same with Charles Cullen, who was, nobody could have guessed what he was really like or what he was pretty much doing until the very end, when he started contributing very strange behaviors, worry, and just when you feel like you're about to get caught, that's what he was like. Insulin in itself, Heather's murder weapon, is a very commonly used thing for not only suicides, but for murder. So Heather's dosage had to have been high enough to notice in their bloodstream for it to kill them. How she didn't get caught beforehand or anyone had noticed, it could have been solved by a blood test. Autopsy, getting a blood test, I'm surprised it just did not show up. Because it will. The amount she had to use, it would have shown up. It's disappointing how she could have been caught sooner, but she wasn't. And that's the thing that really gets a lot of people with, especially these nurses, because you're being watched all the time. There's cameras everywhere in a hospital, and of course they might not be necessarily in the patient's room, but there are some rooms where patients are being watched. And the fact that she wasn't caught sooner, or none of the nurse serial killers were caught sooner, is quite telling. Nurses are too trusted. Everybody believes that when a nurse goes into the field, all they want to do is good. There are tons of people that are just bad nurses, bad doctors, who just don't care for people. And that is in itself really crappy. Just to get a job where all you need to do is care for human life, and you do the quite opposite and you take it away, that is just, it's wrong. And it could have been caught sooner, but of course it didn't. That's happened with all of these people. People get suspicious. Charles Cullen got fired multiple times because people at the hospitals thought he was suspicious. But to cover the hospital's butt, they fired him instead of prosecuting him. So not only is it Charles Cullen who is at fault, it's the hospitals that hired him, let him go freely, knowing what he did. Lucy, on the other hand, people didn't really catch on till parents were being concerned when their babies, newborn babies, were being taken away by her, or she was acting suspicious around the babies, doing all these things. We're not so sure about pressdee at this point. We don't know if anybody ever experienced suspicious behavior, but clearly she got caught. But the people coming into pressdee's care randomly dying, it's a little obvious and should have been looked into way sooner. Not to mention, nursing homes already get bad rep. People release stories and news articles about how nursing homes in general are really bad. Their grandparents and parents just don't get taken care of. They're getting sick. They're having to sit in their own feces and just be there. They don't get fed like they should. They don't get their medicine like they should. Most nursing homes get a really, really bad rep. And not to mention, now you have a murderous nurse on the loose killing your grandparents. That is awful. All the victims of pressdee had multiple problems with them. Some had cancer, some were just diabetic, some were just there. They didn't need much care. Pressdee was giving them 60 units of insulin, effectively killing them. One of the victims, who is not named for her own sake, was a diabetic, and she had went to the hospital right after pressdee had administered her with insulin with low blood sugar. And she was rushed in, given medication, kept alive, and she escaped pressdee herself. None of the victims or the victims' families are listed, sadly. But to keep everything private, I'm sure after dealing with this, they don't want to be known as pressdee's victim. And in itself is a horrible thing to say, because they are people too, and they have their own name, and this does not speak for who they are individually. There's a full list of people who were not diabetic. One or two were diabetic, and upwards to 100 units of insulin is crazy. Most of her victims were, one of her victims were 104, but most of them stuck in the 80 to 190 range. Her whole demographic was really people who just needed care. There's not that many people who were more on the younger side. There was one, of course, that she was connected to that was 55. One of them was 58. One was 68. One was 79. One was 92. Another was 88. One was 83. One was 92. One was 99. Almost made it there, and you ruined it for her. Like, one was 90, 85, 80, 104. The 104-year-old woman was doing well until she got into pressdee's care. She was about to go home to be with her family at 104 years old, being completely healthy, and pressdee took her already. She was quoted saying, "When is she going to die already?" If that was not a dead giveaway into what she was doing, all of these people were just being killed off by pressdee. If that's not a dead giveaway into who pressdee was, or a warning to the people around her what she was doing, I don't know what is. There are tons of people and unconfirmed people that were in her care that have died and were deceased. There could be upwards to probably 50 people that she killed, and we just don't know about it. Sorry for the more depressing and one-on-one episode. It was just me today, no Brie and Ashira, which not as many laughs, but more of a thoughtful, personal conversation and podcast today. Thank you so much for watching the Broken Minds podcast. Bye!
Once again, we would like to give a big thank you shout out to our supporters:
Georgia Hollis College,
Rome Little Theater,
Chia Hall Harvest Fair,
Rome Shakespeare Festival,
WLAQ,
Rome News Tribune,
Meg Trek Collective,
Rome Area Council for the Arts,
and Rome Empress.